Well, my name's Terry Walton, and I'm an occupational therapist, and I've been practicing for about 27 years, and most of that time here at Fredert. And I've worked in just a number of different areas, and now I primarily work in the neuroscience outpatient department with patients post-stroke and brain injury. Well, I think one of the biggest challenges with the stroke population, especially the chronic patients, is spasticity, hypertonicity, and reduced range of motion, and managing that. We use the Dynasplint a lot with our neuro patients, especially they have more moderate to severe tone and or spasticity. It's a great adjunct to just the comprehensive home exercise program, and with everything they're doing to manage their spasticity. You have to do more with less these days, and you really have to space out the appointments, for the whole year, because they may have 20 appointments for the whole year. So you really have to give them their biggest bang for the buck, and make sure that all the avenues are addressed and taken care of. And I think the Dynasplint just helps that, because in some ways it does like their passive range of motion at home for them, and the positioning at home. So it helps, it helps me to carry out what I know my patient really needs. Mm-hmm. We might use the wrist and hand orthoses as well as the elbow orthoses, and they may alternate, wear one night or one day and one the opposite day. So it works really well. And usually they do, their caregiver or their significant other will help them to apply it, and we work with them, with teaching them how to do so. I've used static splints for many years, and we still use them, but the Dynasplint is much better because it provides that low load, maintained force over time. And I think it just really helps them to manage their spasticity and their hypertonicity, for ease of hygiene, doing their ADLs, for their balance, for their IADLs. We use it a lot. I would say we pretty much refer almost all of our chronic stroke patients, if they have more of the moderate to severe tone, for use of the Dynasplint.